Welcome to the next lecture of Unit 4 of BP 103T. I am Anjali Mishra, Assistant Professor of Pharmaceutics at Noida Institute of Engineering and Technology, Pharmacy Institute, Greater Noida. So, let us start with today's lecture. So, as you can see on the slide, there is a mentioning of examples of chemical incompatibility. So, before moving on to the examples of chemical incompatibility, let us understand and have a quick revision of what is incompatibility. So, let us understand this word incompatibility. Incompatibility is nothing but it is a improper mixing that arises when two substances or more than two substances are mixed and they are not suitable for mix or not suitable for each other. So, the resultant that arises is nothing but the incompatibility. Incompatibility are completely and are always undesirable by patients, by medical professionals, by pharmacists or by anyone, because incompatibility is oftenly going to impart inactiveness in product. It is going to make the product look unaesthetic in appearance, it is going to decrease the activity or decrease the potency of a product. It is also going to make the entire thing or the entire dosage form toxic sometimes. So, incompatibility is never a desirable phenomena. However, if factors or if phenomena are not observed properly, there are chances that during mixing, during homogenization, various phenomena takes place and that may lead to formation of incompatibility. In the last lecture, we have seen incompatibilities are broadly classified into physical incompatibility, chemical incompatibility, and last but not the least is therapeutic incompatibility. As the name suggests, the types of incompatibility is going to be very similar, that is physical incompatibility. If there is a change in color, odor, taste, physical state, morphology of a particular dosage form, then the incompatibility that has taken place are classified as physical incompatibility, because whatever the changes has taken place, that changes has taken place in the physical form of the drug, be it the color change, be it your odor change, be it the change in the taste of a formulation, or be it in the change in the morphology of the formulation. For example, if the formulation was originally in the solid state and due to certain improper mixing the formulation has turned or deliquescent or it has achieved a liquid state. So, definitely the compatibility that has occurred is nothing but your physical incompatibility. The another type of incompatibility that we are seeing here is chemical incompatibility. Chemical incompatibility we just saw in the last lecture. Chemical incompatibility is an incompatibility known as immediate incompatibility, fast incompatibility, because whenever a chemical reaction takes place, the time taken by that chemical reaction is not too high. These chemical reaction often occurs very quickly or at a faster paces, hence they are told or called as chemical incompatibility as immediate incompatibility. So, whenever we are seeing chemical incompatibility in any product, we have to be extra cautious while making formulation that involves or that may involve chemical incompatibility, because chemical incompatibility are completely irreversible. If we want to reverse the phenomena of oxidation and reduction, or if we want to reverse the phenomena of decomposition, it is actually very difficult or sometimes even impossible. So, extra precautions have to be taken while preparing formulation that may involve chemical incompatibility. And last but not the least is the third type of incompatibility known as the therapeutic incompatibility. Therapeutic incompatibility, we are going to understand and see an entire big session on that what are therapeutic incompatibility. But before that, we just saw what is incompatibility and what are the types of incompatibility. So, from the continuation of last lecture, we were seeing what are chemical incompatibility. We saw 4 important examples of chemical incompatibility that involved your formation of precipitate, gas formation, formation of non-ionic bonds and color change reaction. Here I would like to add one more thing. Just now I said in the definition of physical incompatibility that whenever there is a change in the color, then that type of incompatibility is termed as physical incompatibility. But here I am saying that color change is an example of chemical incompatibility. So, what difference here I want to convey? very important difference is that whenever there is a change in color, initially the change in color is visible, it can be visible clearly, it can be seen by the naked eye. So, that scene or that color change is nothing but the physical incompatibility, but we have to understand the picture behind it or behind the scene, that what has made this color change happen, what actually happened that caused the color change of this important phenomena, or what has made this color change to take place. So, this color change is always because of a certain chemical reactions that has taken place inside the compound. So, it is important to understand that what chemical reaction have takes place. So, here color change can also be termed as physical incompatibility, and color change is a resultant of chemical incompatibility. So, not to be confused that whether color change is a sort of physical incompatibility or is it a sort of chemical incompatibility. So, let us understand these 4 examples of chemical incompatibility in a detailed manner. First is formation of precipitate. Formation of precipitate occurs when there is certain improper chemical reaction between the two substances that are mixed together. So, let us understand, most alkaloidal salts are soluble in water, but alkaloided bases are completely or practically insoluble in water and are freely soluble in organic bases. So, this is a statement that has been given here to understand the example that is being mentioned below. Here what is said, that alkaloid salts are soluble in water and alkaloidal bases are practically insoluble in water, but they are soluble in what? They are soluble in organic bases. So, if we want to formulate a dosage form, that is going to involve alkaloid salts and alkaloid bases. So, what kind of solvent should we go for? What major selections of solvent is to be done? So, this is an example that what causes the precipitation and how this precipitation can be avoided. Let us see here. First, here example is strychnine hydrochloride. Definitely, it is a salt of alkaloid. It is a salt of alkaloid. And aromatic spirit of ammonia, it is nothing but it is a base, it is basic in nature, and here the mentioning is purified water. So, whenever these 3 substances are mixed, that is strychnine hydrochloride is an alkaloidal salt and aromatic spirit of ammonia is an alkaline substance, and that is very evident, that is very clear. So, whenever these 2 substances are mixed, there is a formation of precipitate, and formation of precipitate is a completely undesirable effect which is going to decrease the activity of our formulation, or sometimes it is going to produce a toxic effect which is completely an undesirable phenomena in our formulation. So, let us see how this incompatibility can be evoked or can be reversed or can be treated. So, these 2 insoluble mixture combine with each other, that leads to the formation of precipitate of strychnine. Just now I have said in the previous slide that when we are mixing alkaloidal salts and bases with each other, they form precipitate of each other. What they form is, they form precipitate, and this formation of precipitate is never a desirable phenomena. So, what we are doing here is, we are avoiding this problem by taking certain important measures, that is strychnine hydrochloride should be dissolved in half quantity of water and aromatic spirit of ammonia must be dissolved in remaining quantity of water. What is going to happen here is, we are taking entire amount of water and we are taking strychnine hydrochloride is in another beaker or in another vessel, and in next vessel what we are doing is, we are dissolving aromatic spirit of ammonia in another quantity of water. Next step what we are going is, we are taking these 2 beakers separately, and addition of one beaker into another is done at a slower pace, or sometimes it is done gradually. So, if gradual mixing is done, formation of precipitates can be definitely avoided. So, here this is an example of chemical incompatibility and steps taken to avoid chemical incompatibility. Moving on to towards the next slide. Here this slide represents another formation or another incompatibility which is known as the gas formation. To be more precise, gas formation is the production of carbon dioxide or the effervescence production that occurs when there is an improper mixing or in undesirable mixing of two or more ingredients that causes the evolution of gases. Sometimes what happened, the evolution of gases is a positive phenomena. However, sometimes when the evolution of gases takes place due to undesirable effect, what the major thing happens here is the undesirable phenomena may cause decrease in activity of our formulation, or sometimes it may also causes production of toxic ingredients in our formulation. So, it is better to choose the ingredients precisely so as to avoid any sort of chemical incompatibility. Now, let us understand here what and how gas formation takes place and how this chemical incompatibility can be avoided. So, carbonates or bicarbonates react with acid or acidic drug results in the evolution of carbon dioxide. So, for example, if carbonates or bicarbonates reacts with any of the acidic drug, the resulting is formation of gas by the evolution of carbon dioxide, Now, what happens here is these compounds are formulated in an open container to avoid explosion, because whenever there is an evolution of gas, there is definitely gas is evolved at a certain amount of pressure. So, when these pressure are not kept properly, when proper arrangements are not done, there can be explosion or there can be any kind of hazards. So, in order to avoid these hazards and in order to avoid any sort of chemical incompatibility, what we do is whenever we are supposed to react carbonates with your acid salts, what we do here is we ensure that everything what we are making is made in an open vessel, or proper steps are taken to reduce or to decrease the production of gas and to avoid any sort of hazards here. Moving on towards the next example of chemical incompatibility. Here color change is another example of chemical incompatibility that occurs. So, it mainly occurs due to change in the pH. As I have discussed in the physical incompatibility also, change in pH, change in milling process, change in color reaction, change in co-solvency, change in improper selection of surfactant is definitely going to affect the solubility, and here in this slide you can see that this is definitely going to affect the change in color of the particular formulation as well. So, whenever there is an undesirable change in pH of the formulation, what happens here is there is a color change reaction. So, this reaction can be prevented by properly buffering the vehicle. If we have chosen the proper buffer which is going to resist the change in pH, then pH change can be avoided, and eventually what can be treated here is color change can be avoided, or it can definitely be treated. Here I would like to say that, as I have discussed earlier, that color reaction are an result of chemical incompatibility, but color reaction is an example of physical incompatibility. However, color reaction is a result of chemical incompatibility. Moving on towards the next example. This is the last example of chemical incompatibility, known as the ionic reactions. Interaction between large amount of oppositely charged ions may result in formulation that lacks the useful property of the interacting molecules. If large amount of oppositely charged ions are continuously interacting with each other, for example, if huge amount of cations and anions are completely interacting with each other, the resultant what happens, the formulation or the activity of the formulation decreases gradually, or the potency of the formulation is completely decreased. So, we have to be very careful in selecting what kind of agents you are selecting, what is the ionic range of your formulation, how far they are going to interact with each other, because whenever there is an interaction of ionic molecules, it is important to understand that how far they are interacting with each other, because if they are interacting on a huge scale, on a larger scale, the formulation that is being finished or that is being made due to their interaction may lack sometimes the potency, sometimes it may lack its activity, the efficacy is going to gradually come down, and eventually sometimes what may happen is development of toxic products may also takes place. So, such thing has to be kept in mind. Here there is an example, cream prepared using cationic emulgent may crack if mixed with a cream prepared using an anionic emulgent. Definitely, if you want to make a cream which is being prepared using a cationic emulgent, and if there is another cream which is being prepared by using a cationic emulgent, and if these two different polarities of creams are mixed with each other, the resultant that is formed is actually a compound that is completely inactive in nature, or sometimes we can say that it has completely lost its potency, it is completely not at all efficacious. So, it has completely lost its efficacy, and we can say that the cream has broken, or the cream has broken. Then breaking of creams or breaking of emulsions is completely an undesirable effect. You will not get the potency of the formulation, and it is an undesirable effect. So, undesirable effect arises due to the ionic interactions. So, here just revising the types of incompatibility we have just now seen is the formation of precipitate, then color change reaction, then change in the pH, and eventually the change in the ionic reaction. So, these are some of the examples that are majorly responsible for causing chemical incompatibility in the formulation. Let us understand the different types of another incompatibility, that is therapeutic incompatibility. Therapeutic incompatibility is the third most of pharmaceutical incompatibility, and it is one of the most important forms of incompatibility that is to be studied, because if therapeutic incompatibility are not avoided, then it may lead to serious health hazards. We are going to understand each and every types of incompatibility in a detailed manner. So, let us start. It is popularly known as drug interactions. Yes, we all might have heard about this word drug interactions. Interaction is nothing but it is a mixing, or it is a coagulation of certain formulation. So, whenever improper mixing occurs, that may lead to drug interaction. Then it occurs due to mixing of inappropriate drugs or excipients which are antagonist in action. Here I would like to say here, sometimes antagonist action are achieved, sometimes action known as synergistic effect are observed, sometimes tolerance are developed. So, such kind of interaction occurs majorly due to drug interaction. Drug interactions are majorly of two types. First is pharmacokinetics and another one is pharmacodynamics. So, depending upon the type of interaction, whether there is a change in the absorption, distribution, metabolism and excretion of the drug, that type of then such kind of interaction are classified under as pharmacokinetic interaction. If there is another type of interaction that occurs by the drug into their body, then such type of interaction are classified under as pharmacodynamic interaction. Here it is very important to understand, majorly therapeutic interactions are known as drug interaction. Drug interaction are of two types, pharmacokinetic interaction and pharmacodynamic interaction. Moving on, let us understand what are the reasons for therapeutic incompatibility. The reasons can be many. Here I have mentioned 4 reasons. Very first reason is the contraindicated drugs. Now, contraindicated drugs are those drugs which are stopped from taking into certain important medical conditions. If such things are not kept in mind, then what may happens is there can be improper mixing of the drug, which may lead to inactivity, which may lead to toxic health hazards. So, contraindicated drugs if are given together with a particular patient who is already having a suffering from a serious health hazard, then the condition of the patient is going to deteriorate furthermore. So, in order to be more careful with the patient, we have to study the medical history of the patients. We must know that what kind of medication that patient is already going through, whether the patient is taking any of the medication which is being contraindicated with your medication that you are going to supply to the patient. So, it is important to understand that what is the history of the patient. If the history of the patient is understood properly, then such kind of incompatibility is definitely can be avoided. Then the another reason for therapeutic incompatibility is similar sounding drugs. Now, here what happens, whenever we talk about similar sounding drugs, we understand that whatever the physician or has prescribed to us, it is similar to the one that we have heard earlier or we have used it earlier. We might get confused in the name of the particular formulation, that is going to affect the therapeutic incompatibility. So, it is very important to understand if there are two similar sounding drugs, we have to be extra precise with the patients when we are prescribing him or her the similar sounding drugs. Another reason for therapeutic incompatibility is drug interaction. As I have just now said, if there is a pharmacokinetic interaction or if there is a pharmacodynamic interaction, then whatever the incompatibility arises, that is classified under as therapeutic incompatibility. Now, in drug interaction, we have various types of interaction. We have antagonist action, we have agonist action, then we have synergistic action. Antagonist actions are those in type of interaction which is going to be actually oppose the interaction of each other. Such kind of interaction are nothing but antagonist interaction. The next type of interaction is the agonist reaction. Agonist type of reaction are such type of reaction when two or more substances are mixed, the efficacy is going to remain same or it is going to help in the it is not actually going to increase the efficacy or no, neither it is going to decrease the efficacy is going to remain the same. Another and last type of drug interaction is a synergistic type of drug interaction. Synergistic type of drug interaction occurs when we are prescribing medication with another medication which is going to actually enhance the efficacy of a prior formulation. So, such type of effect is seen when one formulation or one medication is helping to increase the effect of another formulation. So, such type of effect or in drug interaction are called as synergistic drug interaction. So, sometimes what happened, there is incompatibility arises due to drug interaction, and if these incompatibility are not studied properly, then what the resultant is going to be your therapeutic incompatibility and eventually overdose. Overdose is a phenomena which is definitely going to give you therapeutic incompatibility. If here I would like to mention an example, if a patient is taking 650 milligram of drug, for example paracetamol, then that patient gets relief from any of the condition like fever or pain, then that is fine for the patient. No therapeutic incompatibility is going to occur in that patient. However, if that patient is actually increasing this dose to, let us take around that patient is making it as 1300, the dose is actually doubled, then what may happen, either the patient is going to develop a serious health condition or the patient is going to suffer through any of the issues, either it could be high blood pressure, it could be liver damage, anything can happen. So, overdose is another important reason in order to understand therapeutic incompatibility. So, these 4 reasons mentioned here are very important reason to understand the therapeutic incompatibility, be it your contraindicated drugs, be it your similar sounding drugs, be it your drug interaction or sometimes the overdose of the drug. Now, let us understand therapeutic incompatibility in a more deeper way. Therapeutic incompatibility are unintentional pharmacokinetic or pharmacodynamic interaction that takes place in vivo after administration of medicinal preparation. Yes, definitely no health professional or any pharmacist will ever want to evoke any kind of therapeutic incompatibility in patients. However, such are often unintentional and it is developed once we are unaware of the patient history, patient eating habits, patient diets. So, whenever we are completely unaware of what the patient is actually going through or eating, then what happens here is there is a chance to develop therapeutic incompatibility. As a result, we have to be extra cautious whenever we are prescribing any medicines to any patient. It is our duty to understand what is the diet of the patient, what is the diet, what he or she eats. Another thing, medical history. So, when these two things are actually kept in mind. So, a large number of therapeutic incompatibility can be minimized, and here these things have to be kept in mind by medical professionals. Here is an example that amine containing drugs are compatible with MAO inhibitors, that is monoamino oxidase inhibitors. So, it is important to understand that whenever we are prescribing two medications which are completely antagonist with each other, and that may actually cause hazards to the patient. So, while prescribing these two kind of medication, it is our duty to go through the diet of the patient, to understand the medical history of the patient, or to understand the medications that the patient has been on through a long life periods. Now, here another example is the contraindicated drug. As I mentioned earlier, some drugs are contraindicated and should not be prescribed in any of the serious condition. For example, if a lady is lactating, if a lady is actually a nursing mother, if she is breastfeeding her child, then what happened? Phenytoin, phenobarbital, chloramphenicol must not be prescribed, because these medication actually enters into the breast milk, and it is going to be a serious health hazard for the baby as well. So, whenever we are prescribing medication for conditions like pregnancy, for lactation, for menopause, for anxiety, for depression, and for serious mental conditions, for serious mental disorders, it is very important for us to understand that the medication that we are prescribing is not going to cause any serious health hazards to our patients. So, here the drugs mentioned here are for lactating mothers. So, apart from these, there are many, or there are multiple medicines that are not to be prescribed for breastfeeding or nursing mothers or pregnant women. Then here is the another type of therapeutic incompatibility known as a drug interaction. Drug interaction, I have just now said, it can be pharmacokinetic or it can be pharmacodynamic sort of interaction. So, here tetracycline is inactivated by the consumption of milk due to presence of calcium, that is definitely present in the milk. So, whenever if a person is consuming milk and at the same time that person is under the you are on tetracycline therapy as well. So, the efficacy of the tetracycline is definitely goes down, because that person is consuming milk, and the calcium that is present in the milk is going to decrease or to stop the absorption of tetracycline into the bloodstream. So, definitely there is no benefit in consuming milk and tetracycline together. So, tetracycline form insoluble complex with milk and do not show any effect on systemic circulation, because calcium ion that is present in the milk is going to hamper the absorption of tetracycline into the milk. So, it is important to understand what drug are you prescribing to the patients who are on any sort of diet or who are consuming, or we have to be very careful with the lifestyle of a particular patient while giving them any sort of medication or any classes of medications. So, that is all about the chemical incompatibilities, physical incompatibility and therapeutic incompatibility. I hope these incompatibility will be quite useful for all of you, and incompatibilities can be avoided if we see proper, or if we ensure proper mixing and circulation of all the substances. So, thank you so much.